Lots of news to discuss regarding the vaccine and the variant people are talking about. But I wanted to first take a moment to discuss recent crime issues in our city. Now, this weekend was particularly bad in South Beach, and armed robbery of tourists were just one of the moments we should never have to even hear about. Over the course of the pandemic, it has only gotten worse, as it seems like we are becoming even more of a magnet for people who come here with bad intentions. It has to stop. I've asked the manager, the chief, and senior staff to immediately take action, including mobilizing a substantial increase in police presence. I've also asked the county mayor to program county police to assist during the most challenging periods. But these are only short-term responses to an unacceptable condition. As I've said before, the entertainment district has to go. We cannot suffer it any longer. I believe it will flourish as an Art Deco cultural district. The rest of our city has embraced that profile. We just need to make that happen in South Beach. We are well past the time for incremental reform. I'll put policing and spring break on our next agenda again, but we need to be willing to take stronger action, even if it is opposed by some powerful businesses and other interests that have done well in the current environment. We cannot continue to water down our response. This is about our safety and quality of life. Now to COVID. Much like the last few weeks, the supply of vaccines continue to be limited in number and limited to who is eligible. Right now, only those over 65 are eligible, although some folks of any age with vulnerable conditions are authorized through hospitals. Because the supply is so limited, appointments are gone often within minutes of availability. Please go to the county website for up-to-date information on where you can call. But remember, you can look for appointments anywhere in the state, so if you can get one in Broward or Palm Beach, take it. Almost no cities have the apparatus or ability to actually deliver the vaccine themselves, as that has been almost entirely the province of the county and state. I did challenge our staff, however, to get in the game. And I'm very proud of what our city, under the leadership of our interim manager, Raul Aguila, has accomplished. Over the last month, we have set up vaccination pods at many of our congregate living communities and at Unidad in North Beach. We've also sent the fire rescue staff to folks who are homebound. And we've transported many from our senior facilities to Mount Sinai to avail themselves of vaccinations there. We've also reached out to our faith leaders and other community support groups to help get to the most vulnerable to get them vaccinated. All in all, the city has delivered or helped deliver well over 2,000 shots. I would add that we don't expect this to be over soon, though. As you can see, we've only given 1 in 4 seniors in Miami-Dade their first dose. This lags slightly behind the state as a whole, and as I've pointed out before, Miami-Dade is not getting its fair share of the vaccine. We have endured approximately 20% of the infections and deaths, yet we are only really getting a little over 10% of the vaccine. That's just not fair. We need more vaccine. Finally, and importantly, while the amount of positive infections and the number of people each day requiring hospitalizations are plateauing, the levels are way too high. Since the governor opened up all businesses, you can see an observable and steady increase. No doubt you have heard about the new variants of COVID that are now appearing in some places. What is known as the British variant is already in Miami-Dade, so it is likely to spread as it has in the other areas where it appeared. Although there is not clarity yet, it does appear that it is likely more contagious and possibly more dangerous than the COVID we have been already dealing with. Here is Dr. Eileen Marty with her thoughts.
The news on the coronavirus is both good and bad right now. There's very good news about vaccines. There are a number of different vaccines that are now showing that they can reduce the risk of serious disease and death, and 2 that are particularly good. But meanwhile, the virus is trying to overcome everything that we're doing. There's the UK variant that's already in our community, and the UK variant has taken over most communities in which it manifests because it's so much more contagious than the original variant. And this UK variant seems to be a little bit more dangerous as well, but we're still working that out. On top of that, in the rest of the United States, we are also picking up cases of the Brazil variant and the South African variant. And those are even more worrisome because the people who have been infected by the Brazil variant or the South African variant are individuals in random communities in the United States. And these viruses are much more capable of causing infection, even in people who have had COVID-19 before. So this is definitely the time to mask up. The vaccines are coming. Soon we'll have as many people vaccinated as possible. But in the meantime, it's very important that we keep up with the use of masks, hygiene, distancing, and avoiding crowded places and indoor spaces when possible.
So please heed Dr. Marty's advice. Now is not the time to let down your guard. Please don't quit wearing the mask or masks. And thanks for all you're doing. Your patience, calm, and sacrifice. Stay healthy and mostly at home.